Are you at particular risk of developing cervical cancer? Have you inadvertently increased your risk factors? What has poor lifestyle, smoking got to do with cervical cancer? What about having multiple sexual partners? This report is going to tell you all about the risk factors for cervical cancer.
Infection with HPV is common, and in most people the body can clear the infection by itself. Sometimes, however, the infection does not go away and becomes chronic. Chronic infection, especially when it is caused by certain high-risk HPV types, can eventually cause certain cancers such as cervical cancer. A risk factor is anything that increases your chance of getting a disease such as cancer. What are the risk factors for cervical cancer then? Sexual history. Several factors related to your sexual history can increase the risk of cervical cancer. The risk is most likely affected by increasing the chances of exposure to HPV. Becoming sexually active at a young age, especially younger than 18 years old, having many sexual partners, having one partner who is considered high risk, someone with HPV infection, or who has many sexual partners.
Sexual activity starting at an early age, at a younger age, less than 18 years of age, having multiple sexual partners and having multiple childbirth does cause an infection with the HPV virus, which eventually can lead to the persistent infection of the cervical canal and the cervix with the human papilloma virus. And in some patients, some people can lead to the changes in the cervical epithelium, which can eventually progress into the cancer.
Smoking. When someone smokes, they and those around them are exposed to many cancer-causing chemicals that affect organs other than the lungs. These harmful substances are absorbed through the lungs and carried in the bloodstream throughout the body. Women who smoke are about twice as likely as those who don't smoke. Having a weakened immune system, human immunodeficiency virus (HIV), the virus that causes AIDS, weakens the immune system and puts people at high risk for HPV infections. The immune system is important in destroying cancer cells and slowing their growth and spread. In women, the HIV, a cervical pre-cancer, might develop into an invasive cancer faster than it normally would.
The disease doesn't affect the immune system per se. HPV is not like HIV. But patients who have HIV also, of course, these are the patients who would have been sexually active most of the time, not necessarily, though there are patients who can get HIV through blood transfusions and needle break injuries, etc. But if a patient has HIV, your immunity goes down, and that is how the HPV can become more sinister for you. So it is also a play of how your body immune system reacts to HPV. If you have a very robust, strong immune system, it is quite possible through your own immune system, you will be able to shed off the HPV virus and not get the HPV-related cancers or HPV-related issues. But if you are weak on immunity, then the HPV can become better of you and can go into develop cancer.
Chlamydia infection. Chlamydia is a relatively common kind of bacteria that can infect the reproductive system. It is spread by sexual contact. Women who are infected with chlamydia often have no symptoms, and they may not know that they are infected at all unless they are tested during a pelvic exam. Chlamydia infection can cause pelvic inflammation, leading to infertility. Some studies have seen a higher risk of cervical cancer in women whose blood test and cervical mucus showed evidence of past and current chlamydia infection. Long-term use of oral contraceptives, birth control pills. There is evidence that taking oral contraceptives, OCs, for a long time increases the risk of cancers of the cervix. having multiple full-term pregnancies. Women who have had 3 or more full-term pregnancies have an increased risk of developing cervical cancer. It is thought that this is probably due to the increased exposure to HPV infection with sexual activity. Also, studies have pointed to hormonal changes during pregnancy as possibly making women more susceptible to HPV infection or cancer growth. Economic status. Many low-income women do not have easy access to adequate healthcare services, including cervical cancer screening with Pap tests and HPV tests. This means they may not get screened or treated for cervical precancers. In New Delhi with Sneha Mordani, Bureau Report, India Today.